day. How are you? Oh, come on, don't tell me. I know you're really doing well. This is your dear Mr. Samrad. I know you know. I'm so happy that you can hear from me. After all with pasture, despite the lockdown, I must tell you this. You've always been on my mind. And I pray to see you soon in good health. See, I've really missed you. Forget. The way you used to come to my office to disturb me, complain this, I've missed all that. I'm telling you. So, hope everything will be fine soon. And I'll get to see you again. And then I'll start with all your troubles. Oh, yeah, all your troubles. Okay, so now, you know why you are here. I've put this video together for you to understand a concept in basic science, which will be tested on Friday or probably Saturday. And I believe by the time you're through with this video, you would have gained a whole lot of something new. In fact, if you can invite mom and dad if they are at home, please do. But do not disturb them if they're busy. So, what is it that you really want to learn? It is reproductive health. Reproductive health. If I should ask you now, what do you understand by reproductive health? Please think for just 3 seconds. Now, this is all about, maybe how healthy your reproductive systems are, right? Okay, if you have thought that way, then you are on point. But what do you stand to achieve at the end of this video? You will not only be able to give concise definitions of reproductive health, you will also be able to state the importance of genetic counseling before marriage as a component of reproductive health. 2, you will also be able to explain some advantages of breastfeeding to both mother and child. You will even be able to correct some individuals about those false beliefs that they have about breastfeeding. See, there are many false beliefs out there that many mothers don't know that they are wrong. So, lastly, you'll be able to state ways of preventing HIV. So, you have a whole lot of this to learn today. So, without wasting our times, let's begin. So, first, let us know what reproductive health is all about. If we have to break it down, reproduction, health. Let's start with production. Let's start with it first. So, according to Wikipedia, reproduction is a biological process by which new offspring is produced from their parents. Can you repeat that, please? Thank you. So, now, you can say the word biological there. So, it means that only living organisms, or should I say living things, are the only one that can carry out this process. And when they do, they will be able to bring forth a new individuals that are similar to them. So, that is what reproduction is all about. What about health? According to World Health Organization, health is a complete physical, mental, and social well-being in which diseases and infirmity are absent. So, can you say that, please? Thank you. So, you cannot be physically fit and we will say you're not healthy. As well as we cannot say because you're physically fit, but you're not mentally all right. we say you are healthy. No. So you must be physically fit, you must be mentally okay, and then you must have a good social interactions with others. So all these form your overall health. Now that you have known what reproduction and health is, let's go on and define reproductive health. Reproductive health can be defined as a state of complete physical, mental, and social well-being in all matters relating to reproductive systems. So, you can as well define reproductive health as the health conditions and well-being of mother and child and any other reproduction related issues. So, the second definition seems more simple. So, you would like to actually repeat that. The health conditions and well-being of mother and child and any other reproduction related issues. As you can see from the picture here, you can see that the mother to be carrying a baby already is physically fit, mentally okay, and you can see the connection between this woman and her husband. That is an evidence of a social well-being. So all these will have impact on our reproductive systems. Now that you have known what reproductive health is all about, there are many components of reproductive health. Yes, but I must tell you this, that despite the fact that we have many components of reproductive health, yet for you to reproduce successfully, it depends on 1. Healthy body. 2. Your reproductive organs must be free from diseases. 3. You must have a well-functioning reproductive system. And 4. You must also be aware of certain hereditary traits. And we have some other factors that we also determine your successful reproduction. So you see now that it is important that we learn all those factors that can have effects or impacts on our reproductive systems, because they are all going to contribute to our reproductive health. Like I said, there are so many components of reproductive health, but we've narrowed all these down to only 3. So we'll be looking at only 3 components. 1, genetic counseling. 2, breastfeeding. 3, HIV transmission and prevention. At the end of this video, you'll be able to know what genetic counseling is, the importance of breastfeeding, and ways of preventing HIV. So let's get right on to it. What is genetic counseling? The word looks like one big grammar, right? No. It is actually the giving of professional advice to intending couples concerning the risks of genetic disorders in a future child. My dear, from this definition, it simply means that genetic counseling is a form of advice that is often given by professionals. They give this advice to only intending couples, those that are about to get married. They can as well give it to individuals that seek such counsel as well. Okay, now what are they going to be discussing about? The professional often discuss about the risk of genetic disorders which may manifest in their future child. Let me tell you this. From this picture here, you can see intending couple here, and we can see a professional attending to them. Now, during this genetic counseling, they are going to be advised about certain risks of genetic disorders that may be running in the family of the man or of the woman. If they are not aware of the genetic disorders, they will carry out genetic testings, and they will be able to understand whether they have or not. If they have, they will be able to adapt, because it's not only about testing. Remember, they will give them professional advice so that they'll be able to adapt to the medical and psychological and also familial implications of these genetic diseases. It is not only about genetic disorders, but what about couples that one partner have HIV/AIDS? They also need genetic counseling too. So through this genetic counseling, they'll be able to learn more about how to deal with themselves and prepare for the future child. So we've been talking about genetic disorders, and here it is printed bold in red. So it is important for us to know what genetic disorders are. So genetic disorder is actually a health problem caused by one or more abnormalities in the gene, which can be transferred from parents to their children. Now that you've known what genetic disorder is, but we've just come across another concept: gene, abnormalities in the gene. Here, I must tell you that it is important for us to also know what genes are. You must have been told in the past, or recently somebody complimented, and the person said, "Oh, you resemble your dad. Oh, you're so beautiful. You resemble your mom. Oh, you and your sister, you look alike." So what does this mean? Now, the look alike, or the similarities between you and your parents, or between you and your grandparents, is actually being transferred from your parents to you. Now, you must know this, that the genes are the one, these genes are the one that actually control this. Now, the genes cannot be seen with our naked eyes, but they are present inside us. They are often transferred from our parents or from our grandparents down to us. So when you grow up, you are also going to transfer these genes to your children. These genes control the characters, those traits that you have inside you. And so, by the time you transfer them to your children, they will also have such characters or traits. As you can see from this picture, we can see this man that the baby resembles him. Of course, that means both of them actually have something in common. Now, from the look of things here, we can see that this man actually have a disorder, and likewise the baby too. So the genes in this man have been passed on to the baby. This is a genetic disorder because these genes are not normal. These genes in this man passed on to the baby are not normal, and we call this condition Down syndrome. What did I call it, please? Down syndrome. Now that we are aware of genetic disorder, abnormal genes, which can be passed from parents to their children, you can see now that genetic counseling actually is important so that we can learn more about them and prepare for them. So, let us now go on to see some common genetic disorders. Yeah, you must have seen those pictures before. But today, in this video, we need to check them out. Briefly, you are aware of those that are called sickle cell patients. They suffer from a condition called sickle cell anemia. It's actually a blood disorder. It is present in the genes as well. It can be passed from parents to the offsprings. Another genetic disorder is called albinism. We must have seen an albino before. They don't have, or they have very little color in hair, their skin, and also in their eyes. Albinos, of course, we used to say they cannot see in the afternoon. They have difficulty seeing because of this absence of colors. This color is not in their eyes as well. So, look at this handsome boy. He's suffering from cystic fibrosis. See, this condition affects lungs and digestive system. And you can see that he's really, really sick. He can't breathe properly. Another genetic disorder is called Down syndrome. A person suffering from Down syndrome will not be able to learn properly. Not only that, such a person also have higher risk of health problems. See, they have abnormal facial features as well. So, somebody who has Down syndrome, the right eye will actually be lower than the left eye, as you can see. The same thing with the ears as well. And you can really tell that they are not healthy. So, this is often passed from parent to the offspring. If it runs in a family, then it's likely that such family, a child coming from such family, will have Down syndrome too. Another birth defect, which can be passed from parents to offspring, is called clubfoot. Clubfoot causes the foot to be twisted in and down. You can see how curved these feet are. They look like a club. You know what is called club? Yes, just like the one used to play cricket. So, someone who has the gene for clubfoot disease can easily pass it on to his or her child. Now that you have known some common examples of genetic disorders, so now this is all what we discuss, or all that will be discussed in genetic counseling. So the question now is, who conducts genetic counseling? Genetic counseling is actually conducted by genetic counselors. They are part of healthcare team. They are well trained and they hold these genetic counseling sessions either in a hospital or in a government family planning centers. Now, what do they do? They are trained to present complex and difficult to understand information to families. As we can see from this picture, these couples are receiving genetic counseling from this professional called genetic counselor, and they are discussing about genetic risks. They will carry out genetic testings on them, and when they are diagnosed of any, they'll be given some options on how to deal with them. Listen carefully. It is important that we learn all this prior to marriage, because if we don't know, we won't be able to deal with those difficulties. We won't be able to deal mentally with those problems when we see them manifesting in our children. Now that you have known this, you've known who conducts genetic counseling, and you've also known where it can take place. Let's now go on to see the importance of genetic counseling. Now, 1, if we know and we are well informed about the existence of genetic disorders through genetic counseling, then we'll be able to make informed decisions concerning our partners, who to marry and who not to marry. See, let me tell you this. If someone has sickle cell disease and marries a woman that has sickle cell disease, all their children will have sickle cell disease. You see that now? Through genetic counseling, we will be able to know this. Also, when one parent has sickle cell disease and the other parent is just a carrier, that is, the other parent is not a patient of sickle cell disease, but is carrying the gene that controls sickle cell disease in his body, then 2 of their children will have sickle cell disease. That means that we can say both of them stand 50% risk of producing children that will be sickle cell patients. That is very, very important. Another thing we need to know is that, do you know that if both parents have sickle cell traits, that means they are not SS, but rather they are AS. They are only carrying the traits, the genes in their systems. Then they are going to have 1 out of 4 children that will actually have sickle cell disease. Here, as you can see. But who should you marry if you have sickle cell trait? You're not an SS, but you are AS. You should marry someone that is AA, that is not affected at all, so that all your children will not be sickle cell patients at all. Now that you have known this, that means you are making a wise decision. And how will, like I said, how will you know all this? Through genetic counseling before marriage. Another thing is that genetic counseling will enlighten you. It will educate you about, about if there is any history of Down syndrome in your families, in your partner's family or in your own family, so that you can prepare ahead. Are you with me? Not only that, you will also be able to prevent common birth defects like clubfoot as well. Do you also know that through genetic counseling, you'll be educated about how to approach health givers on healthcare healthcare options that are available for you. What about those that live with HIV, AIDS? They'll be able to manage their condition and live elderly as well. Oh, do you know that at the end of it all, couples will be able to access healthcare service for LD pregnancy and self-delivery? So you can see that it's very important for us to go for genetic counseling before marriage. Please don't forget this later in future. Now that I have known this, let's now go on to look at the next component of reproductive health, which is breastfeeding. What is breastfeeding? Breastfeeding is a natural way of providing young infants with nutrients in form of milk from mother's breast for healthy growth and development. Let me tell you this. It is very important for all mothers to breastfeed. Why? Because their babies will be able to grow elderly and develop properly as well. So the milk from the mother's breast is very, very essential because it contains nutrients needed for this to happen in the baby. Virtually all mothers can breastfeed, but not all mothers are breastfeeding right now. You know that. So, but I believe, and you also believe, that if they have accurate information about breastfeeding, then they will all breastfeed. What are those accurate informations now? 1, do you know that there is actually a yellowish sticky breast milk produced at the end of pregnancy? In fact, it is the first milk produced from the mother's breast. This milk is called colostrum. Now, colostrum is an ideal food for newborn babies. Why? Because it contains a lot of nutrients. If all mothers know that they produce colostrums, which is very vital for the health of their babies, don't you think they are going to breastfeed? Yes, they will. Another information that some mothers do not have is that, do you know that they need to practice what is called exclusive breastfeeding? Exclusive breastfeeding is a practice of feeding only on breast milk. So they make sure they breastfeed their child for good 6 months. WHO recommends this. Why? So that the baby can receive vitamins, minerals, and even medicine from their mother's milk. Last but not the least is that after 6 months, they can now go on and give their children mashed solid food called complementary food. This is needed to meet the growing needs of the baby. Now, knowing all this, every mother will actually like to breastfeed their children. Now, let us now see the importance of breastfeeding. 1, do you know that breastfeeding is superior. In fact, the breast milk is superior to all other milk for the first 6 months for a baby. You know why? Because of that colostrum. It's full of antibodies, it's full of proteins, it's full of sodium, it has higher fat soluble vitamins. Babies will not have, in fact, they will suffer less from stomach upset and constipation. Do you know that by breastfeeding, babies will have increased resistance to infection? They won't be falling sick of cold, diabetes, and diarrhea. In fact, they will have proper development of their teeth and jaws. Do you also know that while breastfeeding, babies actually bond with their mothers? They learn from their mothers. When they are feeling happy, they learn that from their mother. When they are feeling sad, they learn that from their mother too. And babies will also have higher IQs. You know why? That is actually due to brain development. Do you also know that with breastfeeding, babies are connected to their mothers because they are being held more? They will feel loved. So breastfeeding has these emotional benefits. Okay, now another thing is that by breastfeeding, babies will have lower risk of malnutrition. They won't be obese, and at the same time, they will have lower risk of heart disease. These are the benefits of breastfeeding to the child. Let's now look at the benefit of breastfeeding to the mother. Do you know that during lactation, I just use a big grammar there. Lactation actually is another word for breastfeeding. So during lactation or breastfeeding, menstruation ceases. So that simply means that a mother will not menstruate. And that is a form of natural contraception on its own. Because while breastfeeding, the mother will not be able to get pregnant. That is good. Yes, very, very good. So she doesn't need to be on contraceptive pills, or she doesn't need to make use of any, what do you call it? Any IUCD for family planning at all. It's a natural contraception. Do you also know that during breastfeeding, the mother has while breastfeeding, or if a woman breastfeeds properly, she will have lower risk of breast cancer. Wow, if every mother knows this, they won't want to joke with breastfeeding at all. Do you also know that it is more economical to breastfeed than to bottle feed? Breastfeeding also promotes mother-to-baby bonding. As you can see from this picture, it gives these feelings of warmth and calm to the mother as well. And they don't need to visit doctors every time. Oh, because of my baby is sick today, my baby is sick, he's having a headache, my baby is having stomach upset. No. They won't be spending more on medications at all. So these are the benefits that breastfeeding gives to the mother. Okay, so far, you've learned all this now, but yet, not every woman know this. And some women know something different. So, what are those false beliefs that we really need to clear today? Let's look at some myths about breastfeeding and facts about breastfeeding. Please, I want you to know this, that some women, do you know that they believe that they do not produce enough milk? They think they will even tell you, many women do not produce enough milk, so breastfeeding is not really an option. Breastfeeding is not compulsory. No, that is wrong. In fact, most women produce more than enough breast milk. Are you with me? Another thing is that, do you know that some people believe that breastfeeding changes the shape of breast and reduces its sensitivity? No, it's wrong. The accurate information is that it reduces the risk of breast cancer later in future. Yes. Do you also know that some people believe that it is normal for breastfeeding to hurt? Oh, breastfeeding, it's hurting you. My baby bites me when he's sucking. It pains me when my baby is sucking. No. You know why? In fact, breastfeeding mothers that do not latch their babies very well, they will be hurt when baby is suckling. Can you see that now? So, but if they latch their baby properly, then it won't hurt them. Okay, another myth is that breastfeeding babies need extra water during hot weather. Why are you doing that? It is not accurate. In fact, breast milk itself already contains water. Are you seeing that? Another thing is that some people believe, oh, my baby needs extra vitamin D, so they will go and get tablets. No. You don't need all that. In fact, breast milk is a good source of vitamin D. Are you with me, please? So, knowing all this, you can see that some that are printed in red, they are actually wrong, while those in blue are actually right. So, let's look at more of these myths. Do you know that some women believe that breast milk does not contain enough iron? Wrong. Breast milk actually is a balanced diet. You know what is called balanced diet? All classes of food are present in the correct proportion. That is very, very good. Some people believe it is easier to body feed than to breastfeed. Wrong. It is not so. In fact, it sometimes could be very cumbersome and boring to be preparing all this milk every time. Another myth is that some mothers believe, oh, it is to tie them down. To breastfeed ties them down, and so they may not be able to breastfeed in the public. Wrong. If you know you don't want to breastfeed in the public, please extract the milk and keep, so that when you are in the public, you can give it to your baby. Extract it and give it to the baby. Last but not the least, this is very, very absurd to think that formula is the same as breast milk. No. Why formula? Those one you buy in supermarket, they are synthetic food, they are artificial. Breast milk is natural. Which one will you prefer? Chemical or organic? You will actually prefer chemical. Now, we have busted all those myths. So far, we have learned about genetic counseling, and we have also learned about breastfeeding. So, what's next? Now, we need to look at HIV, the transmission and prevention. This is another important component of reproductive health. What have you learned so far when you were in JSS1? First, if you remember, we were taught way back in JSS1 that HIV stands for Human Immunodeficiency Virus. If you have learned that, you are good. We also learned that HIV is the one that causes AIDS. Yes or yes? And AIDS means acquired immune deficiency syndrome. If you have learned that, you are on point. Do you know that HIV is present in the blood, in the semen, vaginal fluids, and breast milk of an infected person? If you know that, clap for yourself. Thank you. Now, through one of these fluids that we mentioned, anyone can contract HIV. So, with all this that you've learned so far, then let us now see ways in which HIV can be transmitted. 1. Do you know that HIV can be transmitted through sex without condom? That is, by having unprotected sex. The sex can be vaginal sex, it can be anal sex, or it can also be oral sex. Yes. Also, we can contract HIV by sharing injecting equipment, using sharp objects such as needles, blades, even some barbing equipment as well. Are you with me? Also, do you know that it can be passed or transmitted from mother to baby? This can happen while the mother is still carrying the baby in her womb, that is during pregnancy, or while breastfeeding. If the mother has HIV, she can pass it on to the baby during this period. Last but not the least, do you know that HIV can be contracted through contaminated blood during blood transfusion or through organ transplants? So, now that you have known mode of transmission of HIV How do you know if you have HIV? Simply visit HIV centers, hospitals, clinics, laboratories. They will test you by taking blood from your fingers, or taking blood from your veins, or taking saliva sample from your tongue and test it to know if you have HIV. Now that you know ways of transmitting HIV, and as well different methods of testing, now let's look at how we can prevent HIV. Remember, HIV affects our reproductive systems. So, one, I must tell you this, that for you to prevent HIV, follow the simple alphabet of HIV prevention, which is A, B, C, D. What do I call it? A, B, C, D. The ABCD of HIV prevention. What does the A stand for? A stands for abstain. Abstain from sex. This abstinence is the only method that is 100% effective. C, before marriage, abstain from sex if you don't want to contract HIV. This A also stands for avoid alcohol and other stimulating drugs. Why? Because by taking alcohol and other stimulating drugs, you will be exposing yourself to HIV. Taking alcohol will actually dull your senses, and along the line, you can fall prey by having sexual intercourse with a prostitute. By taking stimulating drugs, using sharp objects such as needles, you won't know whether they are sterilized or not, because most of the times these needles are being shared by drug addicts, passing it from one person to another, and they use it to inject themselves. By so doing, they contract HIV. So A stands for abstain from sex and avoid alcohol and other stimulating drugs. What does B stand for? B stands for be faithful to only one uninfected partner. Now, by being faithful, you are actually preventing HIV, and your partner must also be faithful to you too. So it is mutual. You must have known your status and your partner's status as well. So when you are faithful to each other, you can be sure that you will not contract HIV. Now, for some adults that cannot abstain from sex, this C is for them. Condomize. Means that they should use condoms to prevent all this yama disease, as they used to advertise that. They will say yama disease. It's not only HIV you actually prevent, you also prevent some other sexually transmitted infections. What about D? This is don't share sharp objects, drug equipment, or sex toy. So all these A, B, C, D HIV preventions will safeguard your life and make you to have a good reproductive health. So far from all we have learned today, we've been able to see that reproductive health requires that we have proper genetic counseling, and after we get married, mothers should breastfeed their babies, and we should all make sure we prevent HIV. We should say no to HIV/AIDS. Why? Because HIV has no cure, no vaccine, and as well, only precautions can reduce the risk of contracting this virus. Remember this every time. Finally, let's look at all we've learned today. From everything we've learned today, we can see that reproductive health refers to the health conditions and well-being of mother and child, and any other reproduction-related issues. In this video, we've also learned that genetic counseling can be defined as the giving of professional advice to intending couples concerning the risk of genetic disorder in a future child. We also learned that virtually all mothers can breastfeed, provided they have accurate information. Colostrum is the first milk produced by the mothers from their breast, and it's very, very important that every babies have access to it. WHO recommends exclusive breastfeeding for 6 months. We've also learned in this video that breastfeeding a child makes such a child to have higher IQs due to good brain development. It also promotes mother-to-baby bonding. We've also learned in this video some myths, and one of those myths is that formula is the same as breast milk. In fact, we now know that it is not so. Breast milk is natural, while formula is synthetic. Okay, what else do we learn today? We've also learned that HIV can be transmitted through sharing of needles, having sex with an uninfected person, and some other methods too. And we learned that 100% effective method against HIV is total abstinence. At the end of this video, I believe you have gained so many things. So this is how we come to the end. Thank you